question was asked recently about could I have a single veneer redone to match the other teeth? And the pictures that were attached showed a previous composite veneer on a single front tooth. And the person was concerned that if the restoration was 17 years old, it had a brown line along the gum line, and they were concerned that the dentist would have to shave down some tooth structure in order to do the whole entire process. So it was a good question because, yes, when you take off veneers, whether it be composite or porcelain, we have to remove it in some fashion, and it's usually shaving it down to a certain degree. Now, a skilled dentist, one with experience, will be able to remove as little as possible. And quite often it would take a magnifying glass to see that we actually removed any enamel. Inevitably, there will be a loss of some tooth structure. That's not entirely bad because that does give the ceramist or the artist in the lab that's going to fabricate the restoration enough room to fabricate a strong, durable restoration that can be bonded in place. One of the hardest things that we do in dentistry is to do a single front tooth to match the adjacent teeth. Usually what happens is one front tooth is a slightly different color than another front tooth on the other side. And so which tooth do you try to match it to? We do our best with photography and other forms of communication with our lab to make sure that this is as accurate as possible. But quite often it takes a couple tries to get it to match perfectly. Now, everything that we do wears out over time. So it's not unusual to have a veneer or a single veneer or even a few that over time will wear out. Sometimes the gums will recede as we age and the edge of the veneer is obvious. Sometimes the discoloration is an indication that the bonding process is breaking down and saliva or bacteria or both can get underneath the veneer and create a cavity. Sometimes it's just old and unsightly and not as pretty as it used to be. So simply redoing or upgrading that restoration is not unusual or a bad idea. Also, a skilled dentist is also going to be able to manage any discomfort, and most often there's no pain whatsoever when the process is done. Getting numb might be slightly uncomfortable in some offices. We have techniques to minimize or eliminate that. And then when it inevitably takes 2 visits to get the restoration, and in the in-between time, the person will wear a prototype of the final restoration. And sometimes there can be a little bit of sensitivity with that, but usually in our office, either 0 or next to nothing is experienced. So if you're worried about pain, that should not be a problem. And if you're worried about the end result being great, then that just boils down to who you choose as your cosmetic clinician.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomate in the American Board of Dental Sleep Medicine. If you would like to become a patient of Dr. Timmerman or simply have questions, please go to our website, www.drtimmerman.com. That is www.drtimmerman.com. Or call us at 206-241-5533. Or you could email questions for an episode of a future podcast at thewholetoothpodcast@gmail.com.